here we go with part 2 of chapters 41 and 42. We're going to look here at the different causes or types of burns. And I mentioned a little bit in part 1, but we have scald burns, contact burns, flame burns, electrical burns. And here you have you see a small child, a toddler, who has placed an electrical cord into his or her mouth, and you can see the very severe burn right at the lips. And this person or this child is obviously in critical care at this point. You can also have chemical burns. As I mentioned before, some of these different types of burns can overlap with each other. So say a scald burn, it's a scalding liquid that's going to come into contact. All right, it comes into contact with the skin. So does that qualify it as a contact burn? All right, theoretically, what a contact burn would be a hot object of some sort that would make contact with the skin. The electrical cord that came into contact with this child's mouth did make contact, but it's going to be classified an electrical burn because the electricity through the cord, coming through the cord, is what caused the burn. So, contact burns are caused by contact with any hard surface, all right, such as roads, carpets, gym floor surfaces. They can be both a scrape and a heat burn, all right, and the next slide will show different types of burns based on the severity. Now, while this slide might look at a list of types of burns, it is really a list of the causes. A scald, contact, or flame burn could cause any of the types of burns, first, second, or third degree burns, depending on the actual event causing the burn. So, for example, did you complete a dare as a child, as a kid, to see how long or how close you could hold your hand to a candle flame? Or were you severely burned in house fire? All right, both of which are going to be flame burns, but a range of injury from no damage at all to very severe or life-threatening injury. Okay, this table here is similar to table 41.8 in your textbook. And really what this focuses on is the destruction, all right? What is being destroyed within the burn injury itself. All right, so this top row, we have first degree burns. Second row and third row is, sorry, I hope I didn't say second degree. First degree burns here. Second and third row are, well, sorry, I'm just getting all confused here. Second degree burns here are classified as either superficial partial thickness injury or deep partial injury. In your table 41.8, there are different columns, and the columns are separated out into superficial partial thickness and deep partial thickness injury. For the exam, I'm not going to ask you to differentiate between what you would see in a superficial partial thickness injury versus a deep partial thickness injury. Then you have third degree burns. Those are going to be full thickness injury, meaning it damages or destroys the epidermis and then the dermis itself. Fourth degree burns, very similar to third degree, but they're going to be very deep, and they're going to destroy subcutaneous tissue. And this can be tendons, muscle, and bone. And for sure, healing is going to require reconstructive surgery, possibly amputation, and grafting. So, some things to think about when you think about burn injury are, do you see blisters? And if you see blisters and how long does it take to see blisters is going to indicate what type of burn you have. So if you have a first-degree burn and you have blisters after 24 hours, all right, then that would indicate a first-degree burn. A lot of times when you get a sunburn, and it can be a somewhat severe sunburn, you might get little water blisters, right? What does that tell you? All right, that tells you that you actually had a first-degree burn, and that's not cool. It's actually very damaging to your skin to have that. Second-degree burns, if it is the second-degree burns in general, you will have burns within, or blisters within minutes. Third-degree burns, you might have them, you might not. And then fourth-degree burns, very rare. And the reason for this maybe here in the third-degree burn and very rare in the fourth-degree burn is that you're destroying so much tissue, the blisters don't even have the ability to form. All right, healing time. First-degree burns, 3 to 5 days. Second-degree burns, 21 to 28 days, 3 to 4 weeks for full healing. Now, third-degree burns, this says 30 to 180 days. And then fourth-degree burns really will not heal. All right, so what does that mean? Right, it just takes a long time. And with the fourth-degree burn, it says that it really will not heal, but that's not to say that the wound itself won't close over. All right, but what it means is that the tissue is not going to appear back to its original state. All right, so then that's why you have the reconstructive surgery, amputation, and grafting. Now scarring, first-degree burn, none, because you're only damaging the epidermis. It sloughs off, it regenerates, and everything is fine. Second-degree burns, you might have scarring depending on how much of the dermis is destroyed. Right? If it's very little dermis and it maintains really at the epidermis layer, then you may not have any scarring. Third-degree burns, there will be scarring. And fourth-degree burns, absolutely. However, in both third-degree and fourth-degree burns, all right, the scarring is going to be dependent on the level of reconstructive surgery. All right, how much money can you spend on a plastic surgeon type thing? All right, how bad is the burn? Can even the best reconstructive surgeon take care of the problem? All right, so there's going to be a range there with scarring. So on this table, you want to focus on the type of burn and the level of destruction, the healing time, and the scarring. All right, so specific points of importance. All right, I mentioned the healing in terms of really will not heal for the fourth degree, and even the third degree, they'll heal. They just won't look the same. And then, in reference to the scarring, any question on the exam that might speak to scarring, both second and third degree burns will result in scarring. You will not need to differentiate between the superficial partial thickness and the deep partial thickness injury, like I mentioned. And on the exam, you will also have the option of fourth degree burns. All right. So compare this table with the table in the textbook 41.8. Gives you a really good basis of burn injuries. The other thing that I wanted to point out when we're talking about this table, and it's not actually on this table, but in your textbook, is in terms of pain. All right. And in the table, it looks at tactile and pain sensors. In both first degree and second degree superficial partial thickness, the tactile and pain sensors are still intact. So your nerves are still there, and they are firing rapidly due to this burn injury. With the deep partial thickness, that damage could actually be deep enough where you're starting to see destruction of those nerves. And so the pain is going to start to be diminished, or could be diminished to some point. And with the full thickness in the 4th degree burns, those tactile and pain sensors are destroyed in that area. And so you won't actually have pain from that location. Now, does that mean that someone who has a 4th degree burn isn't going to experience pain? No, because you're not, if a person has a 4th degree burn, that patient probably also has 3rd degree burns surrounding it, 2nd degree burns surrounding the 3rd degree area, and so there's still going to be a lot of pain. So here are just some examples of burns that are in your textbook. The top 2 figures are both 2nd degree burns. The bottom picture is figure 4030 of a probably a 3rd degree burn, and you can see how there may have been some healing here, but there's still definitely scarring here. This is going to be a scald burn here. This burn, I'm not sure what the burn injury was. It doesn't say, just the deep partial thickness burn. But it's dry. Right, they're having to peel the paint or peel the skin off. That's going to help in the healing process. Alright, then burn injury assessment. Alright, the severity of burns can be assessed by using the rule of 9s, where the body is divided into areas of the body based on body area. And you've got a short video that talks about this, so it's a good review, relatively short video if you haven't already looked at it. Area of the body burned is a major factor in contributing to the severity of the burn. There are other factors, as those listed on the slide, that play a role in terms of age, medical history, the extent and depth of the burn injury. Infants and the elderly have thinner skin, and therefore it's easier for those age groups to sustain a more severe burn than people outside of those categories. A burn in an infant can be very severe, even if it is just 3 to 5%, because their bodies are not good at regulating heat and fluid levels. Whereas you and I, as what one might consider an adult, all right, 3 to 5%, not a big deal in all reality. All right, so now then your body's response to burn injuries. Quite a few different areas that we can look at to focus on how the body is going to respond. And the first is burn shock, and that's going to take into account hypovolemic shock. That's going to lead to decreased cardiac contractibility. Hypovolemic shock, also called hemorrhagic shock, is a life-threatening condition that results when you lose more than 20% of your body's fluid or fluid supply. So with burns, the body is left without the barrier of the skin. That helps to keep water into the body, so water can leave very quickly, with a high percentage of body area destroyed. This severe fluid loss makes it impossible for the heart to pump sufficient blood to your body, and then hypovolemic shock can cause many of your organs to fail. Alright, so your discussion forum for this week looks at these cellular responses, metabolic responses, immunological responses, and looking at evaporative water loss effect on all of these different effects. The cardiovascular response as well. So I'm not going to talk any more about that. You've got some more notes that you can read below this slide, quite a bit of it. Read through that before you actually do the discussion forum. And that will be the end of part 2.